Okay, hi everyone. My name is Brandon. I am one of the co-chairs for the Advocacy Committee as a part of the Maternal and Child National Network for this term. And I have the pleasure of introducing Breastfeed Durham and Love Anderson, who is one of the founders and is now the Chief Operations Officer for Breastfeed Durham. Love is going to talk to us about what they do, their community impact, their goals, and their mission. And so I will hand it over to Love.
Thank you so much. So, Breastfeed Durham was founded in 2018 by myself and a lactation support provider who worked for a home visiting program. And at that time, I did peer-to-peer lactation support. And we were really angry and frustrated about parents, so many parents in our community needing to drive to neighboring communities in order to get the lactation support that they need. And over the years, our coalition has grown from 2 members to over 2,000. And I'm no longer the executive director of Breastfeed Durham. I'm now the executive director for our global initiative that has 24 programs, including Breastfeed Durham, which is our project, and Bernadette Green is our executive director. And I love this slide because it not only talks about our story, but it also talks about making systems and environmental changes. It takes time and patience, and it's a slow process, and we move at the rate the community is ready to move. We also think about a lot about audience segmentation in our work. We think about different communities need different leaders and need different voices in order to learn and to be successful. We at Breastfeed Durham look at the 10 steps to a breastfeeding family-friendly community, but through a community's lens. And we think about all the communities that are within our city, from our Black Breastfeeding Coalition to our Spanish-speaking coalition. Our coalition, we call it the Tea and Milk Coalition, which looks at the needs of Asian Americans, Pacific Islanders, Native Hawaiians, and Middle Eastern Americans, as well as refugee families from those regions. We think about the needs of our LGBTQ plus human milk feeding coalition, and we think about every one of those letters, and we think about what are the challenges that lesbian families are facing in our community? What are the challenges that two gay dads are facing in our community with accessing human milk? What are all those challenges, and what are the supports that are available in our community? And what I love about thinking about looking at the community through these different lenses is we were able to learn so much that I didn't expect about adoption and inducing lactation. And there's some true magic that happens there. As well as our newest coalition is exclusively for healthcare providers to come together and have conversations about how they're working to create a breastfeeding family-friendly community and all of the challenges and successes that providers are having. And we're all part-time. There's a bunch of us working part-time, all working other jobs, all connecting with the community in other ways. Many of you who maybe work with babies or families have heard about this thing called the Baby Friendly Hospital Initiative or the 10 Steps to Breastfeeding Success from the World Health Organization. It's the most popular 10-step programs with moms and babies. And years ago, the World Health Organization, the World Alliance for Breastfeeding Action, approached the Carolina Global Breastfeeding Institute about this step 10 discharge. And they asked the Carolina Global Breastfeeding Institute to look at their years, decades of research about what is it really like for families after they're discharged, and what would it look like to actually normalize breast, chest, and human milk feeding in a community, a municipality, a city. But we often use the word communities because we know not all towns identify as cities, not all places identify that way. But we also think about it through that equity lens of thinking about the communities within each city. And they came up with, as research loves to do, another set of 10 steps. And so we look at normalizing breast, chest, and human milk feeding through these different steps, looking at government and welcoming atmosphere, looking at systems healthcare, looking at community healthcare, working with businesses and advertising, and looking at education systems. And so in Durham, it's 10 steps. They love their measures. We're coming along and we've been working on this for a really long time. So, starting in 2018, Mayor Steve Schewel first proclaimed, literally claimed, the city of Durham, which is called the City of Medicine, which can be anger-inducing if you are a woman of color living in the City of Medicine with a high infant mortality disparity rate. Seeing Black and brown babies and mamas die for no reason in a so-called city of medicine. And there was a lot of us angry about this, including our leadership. And so the mayor's office and the of council every 3 years have tried to claim our city as a place, a breastfeeding, family-friendly community. And one of the reasons we're so passionate about supporting breastfeeding is it turns out those same things that increase breastfeeding rates decrease infant mortality and maternal mortality. And one of the places we always struggle is a lot of you watching may say, I didn't breastfeed, or I had a really hard time breastfeeding. Of course you did. That's why we're doing this work. None of us are perfect parents, and all of us are struggling on how to meet our infant feeding goals. And that's what this work is all about, helping families to meet their personal infant feeding goals. And statistically, 97% of folks want to be able to breast chest or human milk feed their baby, but they're not able to get the support they need to meet their infant feeding goals. Because a lot of us have heard about the health benefits of breast chest or human milk feeding, but a lot of us don't actually know how to do that for real. And so, step one, we start with the government making that proclamation. And we work with the health department to create a strategic plan, which has all these words and these guidelines on how we're going to do the work. And on February of this past year, the Durham County Department of Public Health signed into action the very first human milk feeding strategic plan based on all these researches from the NACHO, the National Association of Health Departments, looking at other blueprints, looking at other strategic plans from all over the globe on how folks have been able to support human milk feeding. And so that's done, and we're really excited about it. Step two is about having signage all over your community that normalizes breastfeeding. And in collaboration with our Black Breastfeeding Coalition and a local artist, we developed these signs that have been distributed over 42 parks in Durham County that welcome folks to be able to breastfeed. And these signs, they're a little provocative, but they were done on purpose. We talked to families about why families were most often asked to cover up or move. And it's very intentional that you can see areola showing. You can see some gender diversity with families. All the reasons why families are asked to cover up or move, including sometimes because they don't speak enough English. And so we put the signs in Spanish too, which is one of the communities in our city that's really struggling to find safe places to be able to feed their babies. And we have signs in our visitor center, postcards, which I love. These are sticker cards. So when grandma comes to visit our city, my grandma used to love to mail presents to my little 2-year-old back in the day. So you can imagine that your grandma comes to the city of Durham and she sees one of these postcards in the video visitor center and she sends them back to her grandchild, and he's putting stickers all over the house, which is something my little babies loved to do back when they were nurslings. And there's cards on where the best places to go to eat and hang out that welcome breastfeeding. But it's also about working with your first responders, your police department, your firefighters, your EMT, making sure that they understand their role in keeping parents and babies together during emergencies and lactation. So we're touching everybody. Step three is about healthcare leadership and making sure that they all understand the definition of optimal infant nutrition, which means that babies receive exclusively human milk until about the middle of the first year, and they continue to receive human milk all the way until they're about 2 and beyond, which I know we're not all getting this done in the United States. This is super hard and a really high bar if you're back at work. But this is the recommendation from the World Health Organization and now the American Academy of Pediatrics. And we're all learning how to meet these guidelines, even though we maybe don't know how to do it yet. And I want you to imagine what smoking looked like back in the 1980s, wherever you went to a restaurant, whenever you went to a party, everywhere people smoked. I'm a 1980s baby. I was born in 1980. I was the first class in my high school that didn't have access to a smoking room in a North Carolina high school. And I remember all of my friends being really mad, like, where are you supposed to go smoke? And that sounds outrageous to us now, but it's through the work of public health advocates for years that we were able to give folks the tools to be able to no longer be reliant on nicotine. We're giving folks the tools so that babies are no longer reliant on formula unless it's medically necessary. Okay, step 4 is about what I just hit on, informing families about lactation during pregnancy. So in order to successfully induce lactation, it's not really good enough to start having these conversations after the baby comes out. These are the things you need to know about during pregnancy. And that means that doctors are talking to folks about, tell me what you know about infant feeding. How do you plan to feed your baby after the baby is born? And we've developed all of these culturally competent, culturally reflective materials through all of our different coalitions to talk to families about their role in supporting infant feeding, whether you're a mom, a dad, a grandma, an auntie, a parent who uses they, them pronouns. And so I'm going to go through these really fast. We talk about the Welcome Baby curriculum, which hits on skin to skin and feeding cues. It talks about different ways to hold a baby and express milk. And then step 5 is all about breastfeeding in healthcare. And that was that baby-friendly hospital thing that I talked about. So we not only want our hospitals to be baby-friendly, we also want our clinics and all the places that you go when you have a new baby, your pediatrician, your family care provider. We want all of those folks to be doing those things that are the best interest of parents and babies and supporting families' independent infant feeding goals. And so right now, this is the place where Durham's working the hardest, going around to every single clinic in our community and talking to them about how they're supporting lactating families and providing them with additional education and support, again, funded from our health department, so that they can normalize and support breast, chest, and human milk feeding and help families meet, again, their personal feeding goals. And so one of the biggest things that we did was come together with all of the lactation support in the community, all of the IBCLCs, oh, it's alphabet soup, all of the International Board Certified Lactation Consultants, the lactation counselors, the doulas, and we created one place where families can go, whether they're getting served from Duke or UNC or lactation folks in private practice, one place where they can go and learn about all the lactation support resources in our community. And the Breastfeed Durham website has everything, including all those resources that you'd want to see during pregnancy as well. We also work now with the North Carolina Breastfeeding Coalition, and every year we get together with all of the folks who support lactation in our community and we update resources. And I'm going to go through these really fast and share some of the resources that we've developed. We have a piece of paper, an 8.5 by 11 piece of paper. You can see here back and front that lists all the lactation support in the community if you're more of a paper person than a website person. We've gotten together with all the Black perinatal health providers, and we have a huge list of all the different ways that folks support perinatal health. And this is just the top, it keeps going. We've gotten together with different folks who support the LGBTQ plus human milk feeding committee, and we've put together a different sets of resources on all the ways that those families need support, including talking a lot about donor milk. We've gotten together with all the folks who support Spanish-speaking families in our community, and one of our favorite resources helps Spanish-speaking folks who are receiving their healthcare directly from the health department how to navigate all those resources and all those choices. Okay, so that's how we've audience segmentation, how we've talked to different parts of the community to make sure everybody's met through their culture. The other thing we're doing is going and talking to business owners, because whether you're going back to work or you're just a parent going to the grocery store or going to buy materials or picking up food. You want to be able to breastfeed your baby out and about on demand as that baby needs. And so one of the things we've had to do is educate employers, organizations on their role in supporting and welcoming breastfeeding patrons and supporting lactating employees. Okay, so you can see this list. This is one of the materials we gave out years ago. And we used to only have, 2 years ago, we had 30 breastfeeding friendly community partners, but we've been working really hard. And this is how many we have now. I know it's so small handwriting, but I wanted you to be able to see that we now have over 200 breastfeeding friendly community partners in Durham that welcome breastfeeding patrons and support their lactating employees. And we work with businesses to help them set up lactation spaces. And we also talk to businesses about marketing and how they're marketing what the World Health Organization calls breast milk substitutes. And it's really important when we think about marketing. If you think about, again, that reference I made to smoking, or if you've ever learned anything about the opioid crisis, it's really important how we market to both doctors and families about how formula is a life-saving, very needed medication, and babies need it when they need it, but they don't need it when they don't need it. And I remember when I had my little one, I was really particular. I didn't want to do ibuprofen or Tylenol or even the wrong kind of cereal. I was worried about what kind of strawberries this little one was eating and all of those things. The same thing holds for the very first nutrition and the exclusive nutrition that this baby's going to need. We want to be able to provide them with the necessary nutrition, which is human milk if they're able, if the parent's able to, if the baby's able to. And we want to supplement with formula when medically necessary, but not just for marketing reasons. Okay, step 9 is all about employers, which we already talked about. And we were so excited to share that 2 years ago, the Biden-Harris administration passed the Pump for Nursing Mothers Act. And the Department of Labor has put together an amazing toolkit to help support employers on how to support lactating employees, as well as we have the Making It Work toolkit through the North Carolina Department of Health and Human Services that can support employees. And in Durham, we just go around to all the shopping centers, knock, knock. How are you supporting your lactating employees? And usually they're like, what are you talking about? I don't know how to do that. And we're like, well, how many women do you have in your place? And they're like about 50%. Well, did you know that even people, dads are benefit from being able to have lactation supported? Even dads miss 10 fewer days of work if their spouse is able to lactate. And we talk to people about all the different challenges on having a new baby and how to support and retain those employees. Okay, step 10 is all about education. So you've got a new baby, you bring them home, you have to go back to work. What's going to be the next step? You're going to have to go to preschool. And one of the biggest challenges I had 8 years ago when I did peer-to-peer lactation support is folks would always come to me and they'd say, Love, I've got a new baby. I have to put my baby in childcare. Who's going to be able to support my lactation journey? Who's going to be able to support my infant nutrition goals? And I would scratch my head and I'd say, I don't know. There's nobody registered. Well, now we have over 96 registered breastfeeding friendly childcare providers. And on April 24th, Durham Public Schools is going to proclaim themselves as a lactation friendly school and talk about all the ways that they're supporting staff, students, and parents in their lactation journey and meeting their infant feeding goals. And we've also been working with all of the universities in Durham County so that they can support their lactating students. We've been talking with Durham Tech and Central and Duke, and they're almost done. And there's an amazing list of resources, so much on different ways to support lactating students, especially when we think about our university students, our medical students, but even sometimes our high school students. Everybody needs support on their lactation journey. Right. And my name is Love Anderson, and I'm always happy to answer any questions that you might have. You can reach our entire Durham team at Durham at breastfeedingcommunities.org. And thank you so much for having me today.
Thank you so much, Love. We are always happy to highlight and spotlight those of you who are doing the amazingly hard work to advocate and support our breastfeeding families.